Welcome, everyone. Thank you for joining us today. Today we have Rio Hondo, Health Sciences and Nursing Department. Programs will be Dean Page, and students have submitted questions ahead of time. So if we can have a few minutes at the end to ask some of those questions, that would be great. And take it away.
Okay, wonderful. Welcome, everybody. How are you all doing this morning? Thumbs up? All right, great. Okay, we're going to go through a few things. I hope I'll be able to answer your questions through the presentation. And if not, then we'll take the questions at the end. So this is Health Science and Nursing at Rio Hondo College. Let's get going here. Okay. So when you start looking at what it is that you want to do, you need to figure out a school. And so we have the saying, if you start Rio, you go anywhere. And you can start your path towards a physician, a nurse, certified nurse assistant, social worker, dentist, physical therapist. All of these areas in health science, you can start at Rio Hondo and you can transfer or you can finish at Rio Hondo. Other opportunities. Just because we don't have a defined path for some of these areas, you can still start at Rio and still take your prerequisites. Optometrist is an area that has seen greater interest. Clinical care coordinator, physician assistant, dental hygienist. We do have an EMT program at Rio Hondo. It's out of our fire department, and it is very well known across the state. So you need to figure out what it is you like to do, what you don't like to do. You need to ask yourself some questions. And the very first one is, do you like working with people? If you don't like working with people, healthcare is not for you. You also need to be able to work with machines. Every day is different. Do you like science, math, and teaching? Do you know any other languages? Do you like weird things? And as an example, this is a picture of a baby with microcephaly. She was, or her mother was infected with the Zika virus before she was born. And so she will not live long. But she will live for a while, and you will have to teach the mom how to take care of her. This is a gentleman who had a gunshot wound to his head. As you can see, he's missing a good part of his skull and a good part of his brain, but he is still functional in his day-to-day activities. And this is an abdomen. I don't know if you can see it, about in the middle, a large scar, and then also in the middle is some dark tissue. That is dead skin. And this is a tummy tuck gone bad. And so you need to be able to tolerate these things without gasping or saying, oh my gosh, when you first see them. So once you decide healthcare is where you want to go, you need to decide your path. Do you want to do health sciences or do you want to do actual care? And once you have that figured out, then you need to find a program that best meets your needs and look at what you like to do, talk to counselors, talk about what schools have what, and plan some kind of a pathway. Once you have that pathway identified, make sure you get your GE courses done and your basic science courses done. Almost all of these health science courses require anatomy, physiology, microbiology, chemistry. And if you take them and do well, then they are done and you can check them off and you can move on to the areas that are a little more interesting for you. You do need to do well in those courses. Getting C's in your prerequisite courses and your early science courses is great, but you really do need to do better than that if you want to get into those programs. Health science is very competitive, so do what you need to do well in those programs. Reach out to your counselors. Use the tutoring. Reach out to faculty. Sometimes faculty at campus, at community colleges or four-year colleges seem a little standoffish. Reach out to them. They have office hours. They are there to help you be successful. And some campuses have wonderful programs, MESA programs, STEM programs. Reach out to those programs. Clubs, we have nursing clubs, we have health science clubs at Rio Hondo. So use those programs to reach out to other people. At Rio Hondo, we have an orthotech program. It's a great way to get started in healthcare. The prerequisite is anatomy. And
in California.
We see about 300 to 350 patients a day. 25 to 30 of those patients are fractures, and we go both to the hospital and the clinic to check on those. 15 of those will be wound care. 20 to 30 of those will be braces and custom splints. Skill sets needed to be a successful orthopedic technician are: number one, compassion. You have to be able to have compassion towards another person who is in pain, because that's what we see all day, is people in pain.
And overall, I think that the productivity and the ability to do the best patient care that we have is because of our cast techs. A lot of times there'll be things that they'll see that we won't even notice. So there's no question in my mind that a good, successful orthopedic surgeon is only as good as his cast room tech.
okay. So the orthotech program is a prerequisite of anatomy. We, excuse me, we start you in August and you go through to the end of the next August, and you are ready to be hired. We are constantly getting calls from orthopedic clinics. Do you have orthotechs that we can hire? And I'm always sending that out. So that's a good way to get into healthcare. We also have a registered nurse program. It's an associate degree program. It's the same licensing exam as a BSN program, and we have multiple collaboratives with BSN programs. So like all RN programs, we have some basic prerequisites that are required by the Board of Registered Nursing, and that's anatomy, physiology, and microbiology. There are some programs themselves that will require chemistry. We do not require chemistry. However, there are a lot of physiology classes that require chemistry as a prerequisite. We also require psychology, sociology, reading, English, and math. Statistics is the best math to take. And you also need a Social Security or ITIN number, and that's a Board of Registered Nursing requirement. For most community colleges in this area, we take the TEAS exam. It's an exam that measures how much you retain of your science, your reading, your math, and your English language uses. We also encourage you to either volunteer or have some work experience in healthcare. That will really help you decide whether or not you want to go into nursing. Getting into nursing is really a big investment on your time, and you don't want to do that if that is not for you. So once you're in our program, the fundamentals course is the very first course, and that's the first semester. And if you pass fundamentals, then you have 4 more semesters of the RN program, and you can transfer then to a BSN program. In order to get into the BSN program, you will need to pass the NCLEX, that's the National Licensing Exam.
During the Crimean War,
more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
Okay, so we see that nurses make a big difference. So you need quite a range of knowledge in order to progress. We have a vocational nursing program. The prerequisites are a little different than our registered nursing program. You do need to prove you have graduated from high school or completed the GED, or if you have a college degree, that will work as well. We have a course called HS60. It combines anatomy, physiology, a little bit of medical terminology, and a little bit of nutrition. You must have psychology. And again, you need a social security number or an ITIN, and that is required by the BVNPT. This program is, is 3 semesters. You do work with patients in the very first semester. You will earn at least a certificate of completion, but we also offer an associate's degree in the VN program, and you will take the national licensing exam for vocational nurses. We have an entry-level program. You can become a certified nurse assistant. You need a high school diploma. You need to be 16 years old, social security number, tax ID number, and you have to have a government issued ID, some sort of California driver's license or something of the sort. Once you have your CNA, then we have the home health aid course, and in 8 weeks, you then earn the certificate of a home health aide, and you can work in home health. And we also offer an acute care aide program once you have your CNA, and this enables you to be hired in acute care at a hospital. So why the prerequisites? Well, outside of doing other things once you get your license, we need you to be successful to get your license. So why do you need math? Well, a lot of it has to do with calculations and medications and fluids. One example, a physician orders 800 units of heparin, 800 units of heparin per hour. So that's going to go through the IV. And the pharmacy delivers an IV bag of 250 mLs with 25,000 units of heparin. So you need to be able to calculate how many mLs per hour you would need to give to this patient. So you need math in order to figure that out. Why do you need microbiology? Well, if a physician orders a dressing change and you need to clean the wound with saline, the wound's infected. As you prepare your supplies, do you put that saline cap in the up or in the down position? Your microbiology will tell you which way you need to go. Okay, why do you need anatomy? So if your patient is taking digoxin, that's a heart medication, you need to assess the heart rate and rhythm at the point of maximum impulse. In your anatomy class, you're going to learn that the PMI, point of maximum impulse, is at the fifth midclavicular space at the fifth intercostal space at the midclavicular line on the left side. So you need to know what all of that means. If your patient has a left trimalleolar fracture and the doctor orders that you need to elevate that part of the body up on a pillow, what part of the body do you need to elevate? And that's actually in the left ankle area. But you only have the information left trimalleolar fracture, elevate, affected part on the pillow. That's the way physician's orders are written. So you need to know what part to elevate. Once you're in healthcare, what does that enable you to do? Well, you get to work. And you can work in all sorts of areas. You can work in surgery, you can work in dental clinics, you can work in outpatient surgery centers, you can work in clinics at the bedside, you can work in physician offices, all sorts of places you can work. You have a flexible schedule. You can do all sorts of fun stuff. You have time to spend with your families. What's really nice about healthcare is that a lot of it is arranged on a 3-4 schedule. You work 3 days, 12 hours a day, you're off for 4 days. And if you do it right, you can work 2 full-time jobs for a little while and save a bunch of money. You can also volunteer. Me, personally, I volunteer with Special Olympics. I volunteer with Scouting. And a lot of it has to do because I am in healthcare. How, if you can you support yourself? Well, yes and no. As a CNA, you may not be able to support yourself, but you can contribute to the family income. Starting salaries for CNAs go between $15 and $20 an hour, and they do go up from there. As an orthotech, starting salaries are $18 to $25 an hour. And if you become nationally certified, you can earn quite a bit more. An LVN can start at $20 to $25 an hour and can definitely increase that, especially now during COVID. And an RN can start at $30 to $35 an hour and can easily earn $150,000 a year. So you can support yourself. So I'm going to leave this up for a little bit. All this information is on our website, the Rio Hondo College web address and the basic phone number to Rio Hondo College. Counseling, write that phone number down, 562-908-3410. That's the general counselor number, and they can have a chat with you. They can do it over the phone. They can do it via email. They can chat with you via Zoom, or you can come in and do it personally. And the health science and nursing information is there, and that's on our website. So I am done. I'm going to stop the screen share. There we go. And do we have questions?
Yes, I actually have a lot of questions from students.
Okay.
So let me just go over some of them. Let's see. The first question is, what classes do you recommend taking in high school if you want to major in healthcare?
If you have a choice, try taking some introduction to biology, anatomy, physiology, so that way you know whether or not you like those topics.
The next question is, let's see. Getting into a nursing program is really difficult. What should one do to stand out?
Getting a job or volunteering in healthcare in the last 5-6 years, I would say we have had 2 to 3 people who've actually gotten into the program. And once they realize what a nurse does, then they leave the program because it wasn't what they wanted to do. So make sure that you know that this is what you want to do. The other thing that you really need to do is to do well on your courses. The minimum GPA to get into the program, both in the sciences and college, is 2.5, but that is a minimum. The higher your GPA, the more likely you are to get in.
About how many students are admitted into the nursing program at Rio Hondo every year?
Every year, the RN program admits anywhere between 60 to 80. We've dipped to 60 because of COVID, but we are slowly increasing. Our max is 80, and that's limited due to our clinical placements. For the LVN program, we admit 30 every year. And for the CNA program, it's anywhere between 24 to 45 every semester.
So I know at some other community colleges, the way that students get into the nursing program is kind of like a lottery system if they meet the minimum requirements. Is that the same at Rio Hondo?
That is for the LVN program. For the RN program, we use the Community College Chancellor's Office multi-criteria evaluation tool where we score the applications. So those students that have more of their GE courses done, higher GPAs, hours recorded in volunteer work or worked in healthcare, high scores on the TEAS exam, those applications score higher and they're more likely to get in. For the LVN program, if you meet the minimum prerequisites completed, then you're in a lottery system. For the CNA program, if you turn in your application before somebody else, you're more likely to get in.
Okay, and what can high school students do to get experience now? Like, do you have any suggestions for local programs that might have volunteering opportunities or shadowing or anything like that?
Yes, most of the hospitals have volunteer programs. So it takes a few months to get in because you have to complete health and safety requirements, CPR, you have to do your TB skin test, and you have to take a few classes before you get to actually do the volunteer work. So contact your local hospitals or your local nursing home. Get a job as a ward clerk. You can volunteer with Red Cross. There is a program called COPE, C-O-P-E. We've seen a lot of students come through our program that have done volunteer work with COPE. And that is a program that introduces you to different areas in a hospital. You get a few hours in each of the different areas, so that way you have a very good idea of what is involved in healthcare.
Here's another good question from a student. This is a two-part question. How does Rio Hondo Health Sciences program stand out compared to other colleges? And are there support programs for health science nursing students, such as tutoring or first-gen support programs?
Yes, first-gen support programs, EOPS, and that is across the entire campus. That's not just for nursing. And we have 2 nursing clubs, as well as a mentoring program for our nursing students. So our graduating students mentor the incoming students and help you along, introduce you to what it is you really do need to know. What was the other part of that question? I have forgotten. Oh, how do we stand out? Okay. Thank you for that question. That lets us toot our horn. For our CNA program, currently 100% of our students that take the state certifying exam are passing. For our LVN program, we are at 95% first-time pass rate. And for our ADN program for the RN, we are at 94.5% first-time pass rate. So if you look at a lot of the other community colleges around us, you will not find that high of a pass rate.
All right. The next question is, what is a typical day like as part of one of these nursing programs?
That depends on the day, if it's a clinical day or if it's a theory day. If it is a theory day, you will be on campus for a few hours in class, anywhere from 2 hours at a time to 4 or 5 hours at a time with 1 to 2 classes. And typically you will be in the skills center or in our simulation center in addition to those hours. On a clinical day, our clinical days go anywhere from 9 hours to 12 hours a day, and you will be at the clinical site. Some of our clinical days start at 6:30 in the morning or 6 a.m. And so you have to be there parked on the unit, ready to go, your lunch put away, ready to go at 6 a.m. So they start pretty early. And if they go 12 hours, then you're there until 6 p.m. working with patients, working with your instructor, working with other students, and really learning what it is you need to apply to be safe in taking care of 1 to up to 4 patients.
All right. The next question is, could you share a little bit about your educational background and professional history?
Sure. I wanted to be a physician, or so I thought. That's the way I grew up. I was going to be a doc. And I did some volunteer work at Rancho Los Amigos Medical Center in Downey and realized I did not want to be a doctor. What I wanted to do was be a nurse, because it was the nurses, to me, that spent more time with the patients, educating the patients, and actually providing the care. I went to Cal State Long Beach. By the time I was 21, I had my bachelor's degree, I had my public health certificate, and I had my RN license. And so I was well on my way to being employed as a nurse. I worked as a nurse for a few years at a local hospital and realized that I did want to get into teaching, so I needed my master's degree, and I did that at USC. And while I was there, they opened up their intrastomal therapy nursing program, and that nurse is now known as a wound ostomy continence nurse. So I did an additional year of postgraduate work, became certified in wound ostomy continence nursing, and I worked as a float RN at a local hospital, as well as a certified nurse in wound ostomy and continence care. And I've done that, I did that for 36 years. Once I started doing that, I started teaching, and I began teaching full-time. And so I was working as a nurse part-time, teaching full-time, and I had a family all at the same time. So now I am the Dean of Health Science and Nursing at Rio Hondo College. I've been here about 32, 33 years, and my kids are grown, and soon I will be an empty nester. I'm looking forward to that.
Thank you. And the next question is, how much would you say you spent on your education slash how much debt did you go into for all your degrees?
I was very lucky. I did not go into debt. I was able to work as a CNA while I was going through school to get my bachelor's degree, and that pretty much paid for everything at that time. Most of our students in our associate degree program do not go into debt. They are able to afford to go to school and work all at the same time. A community college is really a great pathway to take. It's only $46 a unit. If you go to a 4-year, you're looking at $300+ a unit. For my master's degree, I was able to use scholarships in order to get through my master's degree. My expenses were primarily related to getting to my clinical and purchasing books. And so I was able to manage to get through that, work during the summer so I could save money and not have to work nearly as much during the school year.
Thank you. The next question that students have is, what schools do Rio Hondo work with when it comes to transferring? How many students who finish one of the health sciences program transfer to a 4-year institute?
We have collaboratives with Cal State LA, Azusa Pacific, Drew University, CSU Fullerton. We're starting one with Dominguez Hills. Actually, that one has actually started. We have 2 students in that. I would say about 50% of our RN students currently participate in a collaborative. The other 50% wait until they're done with their ADN. They typically start working at a job and then they go back for their bachelor's degree. In the last 10 years, I don't think there's more than 1 or 2 students who have not pursued their bachelor's degree.
So you would say that, the ADN is like a stepping stone, but students should definitely go back for their BSN?
Majority of the hospitals want a BSN. What's happening now, though, is a lot of the nurses are retiring, as well as nurses have been burned out from COVID. So hospitals, clinics, urgent care clinics, surgical centers are scrambling for nurses. Even home health care agencies are scrambling for nurses. And so they will hire just about anybody who has been through a nursing program. It used to be that you needed to demonstrate you are in a bachelor's program before they would hire you. Not anymore. So we're finding all of our students from last year, almost every single one of them had a job lined up before they graduated, before they even took the NCLEX. So we were very pleased to hear that for them.
For the health sciences programs, there's a bunch of different ones that Rio Hondo offers. Are any of them open for dual enrollment for high school students to take?
If you have completed the prerequisites, sure. The problem is you're going to have to come to class. We don't offer hybrid classes, as well as you have to take your clinical at the same time that you take your theory. That's a requirement from the BVNPT as well as the Board of Registered Nursing. For the orthotech program, the clinicals are during the summer. So you will not need to miss any high school classes. So you could if you've had the anatomy course, the college level anatomy course with a lab, you could take the theory in the evening. You have to come to campus. And then in the spring, the casting part of lab is on a Saturday for 16 Saturdays. And then clinical is during the summer.
Oh, one question that I have is, how do AP courses like AP biology or AP chemistry factor into transferable courses at Rio Hondo?
That's a good question for a counselor. What I can tell you is AP Biology and AP Chemistry will get you college credit, but AP Biology will not meet a prerequisite for the nursing program. And I really do not know if AP Chemistry meets the Chem 110 requirement for physiology prerequisite. It will get you college credit, but I don't know if it meets that prerequisite.
Thank you. The next question that we have is, let's see. Okay, so do you have any more recommendations of what classes should a student take during high school if they're interested in a sports med or orthopedic doctor career?
So that person needs to take the pathway to be a physician. So anatomy, physiology, microbiology, Chem 110, all of those will be definite prerequisites to whatever program you wish to transfer to. The best thing for that student to do is identify which schools have the sports medicine physician program that they want to transfer to. And then you will definitely need a bachelor's degree from somewhere before you apply to med school. So if you want to be a sports medicine physician or an orthopedic surgeon, then you need to identify the program that you want to go to and what do they look at and what do they recommend as a bachelor's degree before you apply to that program.
I believe Ms. Mozelles has a student that has a question.
Okay.
From the camera? Oh, hi. I have a question. I'm considering going into the aesthetic field of nursing. Do you have, like, for example, like injections? I'm sure you know. But I was wondering, like, what pathway you would recommend for this job?
Okay, thank you for that question. Most of those programs require first that you become an RN. And so you need to do the typical stuff to be an RN. And once you're an RN, then there are further courses that you need to take or work with a dermatologist in order to earn those skills or learn those skills.
Okay, thank you.
Thank you.
That actually leads into my next question is, how do you get to choose your specialty as a nurse? Do you rotate through different departments? How does that work?
As a nurse, pre-licensure exams are required by their respective boards to prepare you for general entry into nursing. So we rotate you through all of the different areas of a hospital or a clinic. And you have that basic knowledge. Once you are licensed, then a hospital will hire you, usually in a med-surg area, medical, surgical, general area, or some hospitals may hire you into a specialty area if you come with strong recommendations from your clinical instructors. We encourage our students while they are at a clinical hospital to talk to the people, their nurse that they're working with that day, the charge nurse they're working with that day, about what it would take to get hired at that facility. Every time you are at a clinical hospital, you are being reviewed as a potential employee. So all of our hospitals that we go to, we encourage them to apply for work at that hospital. Most hospitals do not hire new grads into specialty areas. You need to have basic skills down pat. You need to be strong in your assessment skills, strong in your ability to discern when something is normal versus abnormal before you can go into a specialty.
All right, the next question. So we have about 15 minutes left. So teachers, if your students have any questions, feel free to unmute yourself to ask. If not, I'll continue to go through the questions that students submitted ahead of time. The next question is, what is your normal day-to-day when you were a nurse, and how was your experience?
My normal day to day was never a normal day to day. Every single day was different. And that is one of the reasons why you need to be able to enjoy that, enjoy the fact that what you expect is going to happen is not usually what happens. As the wound care nurse, I would come in, I would have a list of patients that physicians had ordered me to go see, do assessments, make recommendations, give them a call, figure out what we're going to do to help this patient heal their wound or take care of their ostomy, take care of their incontinence issues. As a nurse working on the floor, I would come in, be ready to go. Report would start at 7 a.m. So I was ready to go before 7. I would get my assignment. I would make rounds with the nurse going off shift, and she would give me, or he would give me, report at the bedside. I'd ask the patient if there was anything else that they needed during the day. We would make a quick plan for the day with that bedside nurse and then move on to the next one. That way I got to see the patient as well as hear what the report was, hear what the plan was, and the patient got to hear it. Then throughout the day, pass medications, carry out orders, educate the patient, send them off for tests, make sure tests were being done, make sure we got the results back, make sure physicians came by and saw the patients that they were supposed to see. You'd be surprised how many physicians would come by with the list and somebody would be missing from the list. And so we would need to make sure we got the patient seen by all the physicians that needed to be seen. And then arrange for discharge planning. We had discharge planners on the unit, but we needed to make sure that the discharge planner understood what it was that the patient needed. And then 6:30 would roll around. I'd make sure all my documentation was done. I was ready for report. And 7 p.m. would roll around and the oncoming shift would meet me and we would make rounds from patient to patient. Again, I would be giving report. We'd ask the patient if there was anything else and move on to the next patient. So when I worked as a wound care nurse, my days went from 5 or 6 hours a day up to 16 hours a day. As a nurse working on the floor, I was typically 12 hours a day.
And a question that just came in from a student is, what is the biggest struggle that you've had in your nursing career, and what helped you to stay motivated?
I've always loved what I've done. Teaching patients, teaching students, teaching physicians is really what motivated me. I had knowledge that I could share and help people learn about themselves. The biggest challenge is when patients didn't believe what I was saying. And let me give you an example. As a wound care nurse, it almost doesn't matter what I do to the outside of a wound in order to heal it. What matters most is what the patient does to make their body as healthy as their body can be to heal the wound, because wounds really do heal from inside out. And the hardest thing to get some patients to do was to stop smoking. And I think that was my biggest challenge in helping someone to understand that their smoking was first caused their wound, second made their wound worse, and third prevented it from healing. And once I was able to get through to a patient about that, even to get them to reduce their smoking, then their wound started to heal, then we were on the right track. So I think that was my biggest challenge, was to get somebody to actually believe what I was telling them was true.
Okay. We're down to the last like 10 minutes or so. So what are the steps in order to take the NCLEX? And if you get the NCLEX, does that mean you have like a nursing license that you can use at any state in the US?
You bet. So to be ready to take the NCLEX, you need to complete a nursing program that is approved by the Board of Registered Nursing, whatever state you're in. And the exam is national, but the license goes state by state. So once you take the NCLEX, you pay for your California license. I just renewed mine, and that was $150. In order to renew mine, you have to renew it every 2 years. Once you have your license, then you can apply to other boards of nursing, other state boards of nursing, to have your license recognized. And once they recognize it, then you pay for your license in that state as well. And you will have multiple licenses. We do not have a national license. I'm sure soon we will, but we don't. So if I were to want to work in Nevada, let's say I wanted to move to Las Vegas and work in Nevada, I would have to apply to the Nevada Board of Registered Nursing, let them know I have this license in California. There's nothing against my license. We call it unencumbered. There's no complaints, no reports. And then what they will do is ask the California Board of Registered Nursing to send over all of my information. And once it's approved, then I have to pay for that license in Nevada, and then I will be dual licensed.
All right. The next question is, do you have an idea of what's the average salary for an RN after they graduate?
If you have your associate's degree and you're working in the hospital, a starting salary is somewhere around $70,000 a year.
Okay. And what's the like highest that someone could get as a nurse for salary, you know?
Yeah, you can make quite a bit of money. It all depends on what you are willing to do and how much education you're willing to get. If you want to be a nurse practitioner, if you want to be a nurse midwife, if you want to hold a couple of jobs, I know some bedside nurses with associate degrees who do 36 hours 1 week at one place. Same week, they do 36 hours at another place. And that's what they do. They work 6 12-hour shifts in a week. That's 2 full-time jobs. They're making about $250,000 a year. They do that for a couple of years. They buy a house, and then they go back down to one job.
Okay. And for what's the main difference you would say between like a RN and a nurse practitioner?
A nurse practitioner is an RN, but a nurse practitioner has a master's degree as well as residency as a nurse practitioner. As a nurse practitioner in the state of California, you need to practice under the direct supervision of a physician, and you have a prescribing license. And so you can prescribe certain medications. You see a certain caseload, you have patients assigned to you, but you need to confer with the physician about the care of those patients. Nurse practitioners in other states have less restrictions on them. They see a caseload of patients without being directly supervised by a physician. They have remote supervision, which means they have monthly meetings with those physicians to discuss patient care.
Okay, great. Teachers, do your students have any more questions? No? Okay.
No, we're good.
Okay, great. So if there are no more questions, we will be ending soon. And before we end, Dean Page, do you have any final words or advice for our students before we end for today?
Go into healthcare. You'll always have a job. Always. Everybody is going to need healthcare. And there's so many things that you can do in healthcare. As well, continue your education. The more education you have, the more doors are open to you. You can get into healthcare very easily with only certificates. You can get farther with associate degrees, farther with bachelor's degrees. You don't have to do it all at once. You don't have to ram through and get your master's degree right off the bat. You can do it one step at a time.
Great. Thank you so much for your time. And we will be ending our session for today. Thank you all for joining us and have a great rest of your day. Bye.
Bye. Thank you, everybody.